Having undergone specialist training in Moorfields Eye Hospital in United Kingdom, I had returned to my hometown of Ipoh in 1974 with the aim of providing affordable, quality eye care services to my patients. LEC Eye Clinic was founded at that time, and from being a solo eye care practitioner in this clinic, LEC Eye Centre was subsequently born in 1999 with the inclusion of 2 other consultant eye surgeons. Since then, we have grown to become a Ministry of Health recognized day surgical centre, and to date, LEC Eye Centre is the largest private group practice in Perak with 4 consultant eye surgeons.
LEC Eye Centre is a one-stop comprehensive eye specialist centre, and we're able to cater to all the eye care needs of our patients. We pride ourselves in having the most advanced technology to provide the best outcomes for all our patients. We have premium cataract surgical services, and this involves the acquisition of the first Lenstar optical biometer in Perak, which is actually a laser machine used to measure the eye before cataract surgery. We also have another advanced machine called the Varion Image Guided System, which is actually a precision machine that provides digital marking during cataract surgery. Now, aside from this, we also provide retinal services, and this includes the management of retinal detachment, age-related macular degeneration, and diabetic eye disease. We acquired the first in Malaysia sweat source OCT angiogram, and this actually allows us to take high-definition images of the retina and better manage these diseases. We also want to make sure that we are always accessible to all our patients, and they can make appointments to see us with a click of a button via our online appointment system.
At LEC Eye Centre, we have our in-house optometrists who are vision care experts responsible for accurate testing of spectacle power as well as contact lens fitting. They also provide vital support to our LASIK services. At LEC Eye Centre, we acquired the first in Asia wave-like refractive suite in 2011. One of the fastest lasers in the market, this unique all-in-one suite connects the machines used to measure the eyes before surgery with the laser machines, so all treatment information is sent wirelessly and allows surgery to proceed seamlessly and with unparalleled precision.
At LEC Eye Centre, we recognize the increasing problems of nearsightedness or myopia amongst children nowadays, and we have in place a myopia control program to combat this. This program involves the use of myopin and eye drop, which has been found to be effective in slowing down the progression of myopia in children. So this program aims to increase awareness about myopia and allows our team of doctors, optometrists and nurses to work closely with parents to manage this epidemic which is sweeping the world. A key component of this program is the use of appropriately prescribed eyeglasses, for which our subsidiary company, Eye Care Optical, will be able to provide. Aside from children eyewear, a wide range of adult eyewear is also available.
Hi, good evening. Good evening to everybody. Hope everybody had a pleasant dinner. Let's welcome all our attendees. Mr. Benny, Chen Fanyan Ismail, Julie, Kule Eng, Leong, Dr. Lim. Dr. Lim is also in the house. Lisa, Mak Manyi, Maya, Mr. Muthu Krishnan, Sheila, Ong Chun Hok. Hi, Wai Teng. Wai Teng, welcome back. Wai Teng has been very supporting almost all our webinars she's attending. We also have Dr. Waisili also in the house, and welcome CH. Welcome everyone. Thanks for having spending your precious evening with us. I'm Anna Lam, the host for tonight's webinar. So I will briefly introduce tonight's speaker, which is Dr. Umi. Dr. Umi Kausam is one of our senior consultants. She actually obtained her master's in ophthalmology in 2005 in Hospital University Kebangsaan Malaysia, which is a hospital UKM. She's also a lecturer previously before she started her private practice in Royal Perak College of Medicine, and also a co-supervisor in ophthalmology department. And currently she is also a visiting consultant in Perak Community Specialist Hospital. So in the past, she also a coordinator in the National Eye Database and Cataract Surgery, very highly experienced and competent surgeon for cataract procedures such as pterygium excision with sutureless conjunctival graft, numerous complicated procedures, repair of injuries, LASIK, glaucoma, screen, and also eyelid procedure. Dr. Umi also have a special interest in medical retina and also uveitis. And she's also was put in charge in this eye screening and laser treatment for premature babies, as well as the medical retina services for the state of Perak in the year 2019 and 2011 before she joined the private practice. So let's welcome Dr. Umi. Let's welcome Dr. Umi in the house. Hi, Dr. Umi. Dr. Umi, you need to unmute yourself first.
I'm sorry.
Okay.
Good evening. Assalamualaikum and welcome everyone. So thank you everyone for joining us tonight.
All right. Before Dr. Umi start the presentation, just want to inform all our attendees, all our participants that during this difficult time and during this CMCO, rest assured that we do practice, as just now if you watch the video, we do practice a very strict SOP, you know. So we do have a screening triage counter, we take temperature, ask history, travel history, and any symptoms. And we also very frequent, we do sanitization. And after we screen or check every patient, we sanitize the station. Every station we do a sanitization after every patient. So rest assured, if you do have like any discomfort or you need to come back for your follow-up or to see the doctor, rest assured on the safety. We very concerned about the safety for our patient, for our team, as well as for our doctors as well. So without much further ado, so I don't want to hold you back, and Dr. Umi, please, you can start your presentation.
Okay. Yeah. All right. So can you hear me, everyone? Can.
Yes.
Yeah. Okay. So tonight I want to talk with you about this very important eye disease known as glaucoma, or the other we also this is glaucoma known also as a silent blinding disease. So before that, okay, a little bit about LEC Eye Centre. Okay, I will give my talk in Bahasa Melayu and English. Okay, so sometimes I will talk in Malay and sometimes I will talk in English, right? So LEC Eye Centre adalah satu pusat mata yang telah diiktiraf sepenuhnya oleh Kementerian Kesihatan Malaysia as a daycare surgery. Serba sedikit berkenaan dengan gambar ya. Di gambar yang pertiga pertama ni menunjukkan gambar ground floor ataupun tingkat paling bawah LEC Eye Centre, menunjukkan kemudahan pesakit luar dan bilik rawatan doktor.
Sorry, need to interrupt you. I think your screen has not been shared yet.
Sorry?
You haven't shared your screen, your presentation? Belum lagi.
I am sorry.
Okay,
Okay.
your pretty face.
Okay. I'm sorry. Technical problem.
Want me to have you to share the screen or you can manage it?
Yeah. Let me check. I can.
Okay.
Hold on.
Okay, while Dr. Umi is sharing her screen, I would like to inform all the attendees whether those who have joined us via the Zoom or live Facebook and YouTube channel, we are actually giving out this free comprehensive eye exam for all the attendees. So stay tuned. We will send the link for the registration to all the attendees during the Q&A, okay? So, okay, Dr. Umi managed to share her screen. All right.
Yeah. Okay, so a little bit about LEC. Just now I already talked about this slide, yeah? So we move to the next slide. So ini adalah gambar, 3 gambar pertama adalah berkenaan dengan gambar pesakit luar ataupun tingkat paling bawah LEC Eye Centre, iaitu ruang menunggu dan ruang pemeriksaan oleh doktor, diikuti oleh ini biasanya alat-alat ini, all these instrument are in in the third floor. Okay, all these instrument, the scanning machine, the things, the instrument to measure the lens power for the cataract surgery and so on. Facilities ataupun kemudahan pembedahan berada di tingkat 1, ya, ini gambar menunjukkan ward ataupun ruang menunggu sebelum dan selepas pembedahan, diikuti dengan operating suite bersebelahan dengan ward. This is all the sophisticated latest instrument for the cataract surgery, for the retina surgery, as well for the glaucoma, and mostly of the eye surgery we will do here, unless certain or minor procedure we will do in a third floor. Bermula daripada tahun 2011, kita mempunyai kemudahan rawatan LASIK, terutama untuk mereka yang want to be glasses free or contact lens free, terutama untuk mereka yang mengalami masalah seperti rabun jauh, sebilangan kecil rabun dekat dan juga rabun silau. Okay. Alat ini dipanggil optical coherence tomography ataupun OCT. Dia macam imbasan, mesin imbasan ataupun scan, terutama untuk melihat masalah-masalah saraf mata yang melibatkan retina, macula dan optic nerve. Dan dia sangat penting, ya, alat ini untuk mengenal pasti ataupun diagnosis of glaucoma, monitor progression of the glaucoma, as well as untuk melihat masalah seperti pendarahan pada retina, bengkak pada macula yang disebabkan oleh kencing manis dan pelbagai masalah lain seperti AMD. Antara kemudahan lain juga iaitu optometry services. Kita mempunyai 3 orang optometrist which is specialized for vision care, especially untuk mengukur ataupun measuring the degree of power of the myopia, hyperopia ataupun far-sighted, near-sightedness, astigmatism ataupun rabun silau. Juga mengendalikan masalah seperti contact lens dan memberi preskripsi untuk cermin mata. Optical services, eye care optical, kita mempunyai satu ruang untuk prescription glasses. So siapa yang mempunyai ingin membuat cermin mata ataupun contact lens ataupun membeli sunglasses boleh datang ke Eye Care Optical. Hanya beberapa selang daripada LEC Eye Centre, very near. Okay. Okay, I have no financial interest or relationships to disclose. Topik malam ni yang akan saya bincangkan adalah glaucoma. So untuk pengetahuan semua, glaucoma adalah salah satu main causes of blindness. Maksudnya penyebab utama masalah penglihatan ataupun kebutaan. Sebab pertama worldwide atau masih lagi katarak. Yang pertama masih katarak, yang kedua glaukoma, dan yang seterusnya adalah kehilangan penglihatan disebabkan kencing manis dan beberapa masalah retina ataupun macular problem. Okay. Okay, glaucoma is an eye disease. Okay, eye disease satu, often associated with elevated intraocular pressure ataupun eye pressure. Maksudnya glaukoma adalah satu penyakit mata yang melibatkan masalah peningkatan tekanan mata, dan peningkatan tekanan mata ni akan menyebabkan kerosakan saraf optik. Jadi kerosakan saraf optik akan menyebabkan loss of vision ataupun kehilangan penglihatan. So ada beberapa isi penting di sini. Ia adalah disebabkan tekanan mata, ya, ini adalah risiko yang paling penting, melibatkan kerosakan saraf mata ataupun optic nerve, dan daripada situ dia menyebabkan kehilangan penglihatan. Saya ingin berkongsi berkenaan dengan apa masalah sebenar glaukoma. Dia lebih kepada kehilangan medan penglihatan ataupun visual field, terutama pada peringkat awal, ya. In normal vision, you can see here the full field. The second image, early glaucoma. Sometimes bila you nampak tepi ni hitam-hitam macam ni, maksudnya early field loss. Most of us won't be, alert ataupun recognize all this early symptom or early sign of the visual field loss. Ya, tak perasan kan? Kita biasa tengok tengah, kita jarang tengok daripada tepi. Okay, so that's why sometimes we miss early diagnosis of glaucoma. Okay, in advance ataupun extreme, ya, late stage of glaucoma, then only normally patient will realize that there is something wrong with their vision, because their vision, the visual field become narrow, and then what we call that at the end stage ni dia nampak macam tunnel vision ataupun bila you tengok melalui teropong ataupun terowong, ya. So akhirnya, okay, finally daripada tunnel vision ni, jika masih tidak dirawat, terus gelap semua ataupun terus completely blind. Okay, saya ingin berkongsi sedikit, ada beberapa video yang saya ingin tunjukkan untuk menambahkan pemahaman berkenaan dengan glaukoma. Video ni semuanya video pendek, ya, short video. So bear with me.
Glaucoma is a group of eye diseases in which the optic nerve is damaged, leading to irreversible loss of vision. In most cases, this damage is due to an increased pressure within the eye. The eye produces a fluid called aqueous humor, which is secreted by the ciliary body into the posterior chamber, a space between the iris and the lens. It then flows through the pupil into the anterior chamber between the iris and the cornea. From here, it drains through a sponge-like structure located at the base of the iris called the trabecular meshwork.
Okay, saya nak interrupt sikit. Kita dah tengok tadi the video, ya. Is produced, the aqueous humor ataupun fluid inside the eye is produced by the structure named ciliary body. Satu structure berdekatan dengan lens di belakang mata hitam kita. Okay. Dan fluid yang ataupun cecair yang terhasil will go into the anterior chamber. Ruang ni kita panggil anterior chamber, ya. Dan bila fluid terhasil, dia mesti dikeluarkan untuk menyeimbangkan, to balance the internal fluid. So tempat keluar ataupun saliran keluar ni kita panggil trabecular meshwork. So bila kita nampak sudut ni, ini yang penting ni, sebab di sinilah kita akan categorizekan glaukoma kepada sudut terbuka ataupun sudut tertutup ataupun open angle and closed angle glaucoma. So sudut ni, ya, kalau kita tengok, ya. So ini pengaliran air yang daripada production dia dihasilkan dan dia keluar melalui trabecular meshwork di sudut ataupun bucu mata at the angle. Okay, this angle we call in glaucoma sama ada open ataupun closed angle. Kenapa penting aqueous ataupun internal fluid? Sebab di situlah dia membekalkan nutrient ataupun nutrition to all the cells inside the eye. Right? Okay, we continue.
And leaves the eye. In a healthy eye, the rate of secretion balances the rate of drainage. In people with glaucoma, the drainage canal is partially or completely blocked. Fluid builds up in the chambers, and this increases pressure within the eye. The pressure drives the lens back and presses on the vitreous body, which in turn compresses and damages the blood vessels and nerve fibers running at the back of the eye. These damaged nerve fibers result in patches of vision loss, and if left untreated, may lead to total blindness. Symptoms appear gradually, starting from peripheral vision loss, and may go on unnoticed until the central vision is affected. Progression of glaucoma can be stopped with medical treatments, but part of the vision that is already lost cannot be restored. This is why it's very important to detect signs of glaucoma early with regular eye exams.
Okay, jadi area ni, yang nampak tak? Yang you can see here, this is all retina, and then it merge here towards the nerve. This is the yellow and the signal. What we can see, the eye doctor can see from here is we call that optic disc. Okay, so this is very important here. So we are talking about optic disc after this, right? Okay, what is so important about the optic nerve? Because it carries impulses for sight from the retina in the eye to the brain. Maksudnya dia membawa maklumat atau maklumat daripada mata, daripada retina ke otak untuk diinterpret, ya, untuk interpretation. Ya. So kalau optic nerve ada masalah, maksudnya impuls ataupun maklumat ni tak dapat dihantar ke otak. So kita akan kehilangan, ya, otak akan cakap kita tak nampak lah, ya, kehilangan penglihatan. This is very important also. There is no way to reverse damage to the optic nerve. Maksudnya apa-apa penglihatan yang hilang disebabkan glaukoma tidak boleh dipulihkan dengan apa cara sekalipun. Rawatan hanya untuk preserve ataupun maintain penglihatan ataupun fungsi saraf pada masa itu. Apa yang telah hilang, contohnya patient datang dengan 30% loss of vision, visual field loss 30%, ataupun optic nerve function loss about 30%, ya. So yang kita nak adalah kita nak preserve ataupun maintain that 70% left. All the treatment we give, maybe we offer surgery after that, yeah. But patient cannot have that 30% yang hilang before. So this is very important to understand. Okay, glaucoma we have two main group ataupun dua kumpulan. Ya, kita bahagikan kepada dua kumpulan besar, very simple, open angle and close angle. Ya, open angle, close angle. Just now I showed you from the animation video. So this is again show you the angle from the cornea and the iris. Iris adalah the brown ataupun mata hitam kita panggil, ya. And then this is the cornea, the clear surface, the clear organ, ya. From front of the eye. Okay, this is the angle ataupun bucu ataupun sudut, ya. So in open angle memang nampak open, no problem, the angle is open. Okay, in close angle totally blocked. So why is it close open angle but still you get glaucoma? It is because this is not totally blocked, it's just partially blocked. So that's why in open angle the pressure builds up is insidious or gradually. So mostly you don't have any symptom in open angle glaucoma. Compared to close angle, the angle is totally blocked. So the pressure or the fluid which is produced by the ciliary body here suddenly cause increase in eye pressure because it's totally blocked. No way for the fluid to go out from the eye. So this group of patients, normally the close angle, they will present to us very early because the symptom will be pain, red eye, sudden blurring of vision, compared to the open angle, which is almost no symptom at the beginning, unless when you reach the end stage of the glaucoma, then only you will realize that your vision, your visual field has been lost. Okay. Okay, again, just to compare the presentation of patient with the open angle glaucoma and angle closure glaucoma, mostly, okay, glaucoma patient, mostly about 70 to 90% of patients is fall under this group, open angle glaucoma. So in this group, normally, like you said, insidious, asymptomatic, no symptom at all, gradually, seldom headache, seldom have any symptom at the beginning. So this is what we call silent blinding. Yeah, it's like silent blinding disease. This is in open angle glaucoma compared to angle closure glaucoma. Normally they will present very early because you see the symptom is normally severe pain, nausea, vomiting, redness, and of course blurring of vision. Okay. This is one of the photo example of acute angle closure glaucoma. You can see the cornea is hazy. There is some cataracts over here, and then the eye is a bit is very red, and the anterior chamber very shallow. So the eye pressure normally is very high. Okay, so sometimes more than 50, maybe 50 to 70. Yeah. So the acute management, this is like we call that in acute angle closure glaucoma is one of the eye emergency. This patient should attend immediately. The purpose is to reduce the swelling, reduce the pain, reduce the eye pressure to protect the optic nerve. The purpose is to protect the optic nerve because more than 72 hours, most of the time, there will be some effect on the optic nerve. Normally, the glaucoma, you always state that disease of the elderly or the aging group of people. But don't forget that glaucoma also can happen in babies, in kids, in teenagers, and younger age group. So like these babies, you can see here the difference between right eye and left eye. The right eye is bigger, looks bigger, all right? So this is one of the symptoms of congenital glaucoma, or the babies born with the glaucoma. They will have a bigger eye, okay, compared to the other eye. The other symptom will be tearing, and the child may be frequent have crying because of the pain, always want to rub the eye, and then sometimes you can see all the white patches on the cornea. Okay. Okay, other type of glaucoma, this is like secondary glaucoma. There is something caused the glaucoma. So it may be related to some medications such as steroids, okay, diabetes or hypertension, any metabolic disease can cause glaucoma as well. History of eye injury before, and certain eye diseases can cause glaucoma. Okay, this is, we call that traumatic hyphema. Hyphema means bleeding inside the eye. You can see here, there is a blood in the anterior chamber in the eye. Okay, this is full blood. This is only one mild bleeding inside the eye. This is both. This is caused by the normally blunt trauma. Okay, this is normally, you can see here, very full of blood. Maybe some penetrating injury also because of sharp object. This is from the blunt object. So why they can cause glaucoma? Because even though later the blood may be absorbed, there will be at the angle here, this is the angle, okay, there is some scarring following the injury. So all this scarring will block the drainage system of the eye. So gradually the eye pressure will become increased, and of course cause pressure on the optic nerve and blurring of vision. One of the eye disease which can cause increased intraocular pressure or glaucoma is a uveitis. Uveitis is a term, basically is the inflammation or swelling of the pigmented layer of the eye. We call this uveal tissue. So in this photo, you can see all these flower-shaped pupil, which is not normal. This is because of a lot of inflammation or swelling happen inside the eye. This is also one of the problem. It will block the drainage system and eventually cause the increased eye pressure. Okay. This is cataracts. Cataracts, when it become mature, it can cause problem. That's why we always advise patients not to keep the cataract too long, because in this stage, if the cataract become mature or hyper mature, or Malay said masa or matang, it will cause leakage, leakage of the cataract, the protein material, all this material from the cataract which is already liquefied ataupun dah jadi cair kat dalam mata, dia akan mengalir keluar dan menyebabkan a lot of inflammation. Reaksi reaksi radang mata, okay? Radang mata dan sekaligus akan menyebabkan tekanan mata tinggi. Jadi pesakit dengan masalah katarak yang matang ataupun masak begini, mereka akan datang dengan awal, ya. Salah satu sebabnya sakit dan tiba-tiba tekanan akan meningkat disebabkan macam saya cakap tadi, leaking of the lens material ataupun protein which can block the angle structure ataupun drainage system. So apa rawatan untuk masalah ni? After we control the eye pressure and the inflammation, so the definite treatment will be cataract surgery to take out the cataracts. Okay, how to diagnose glaucoma? You see here, the only way to diagnose glaucoma is with complete eye examination. So when you go for the eye screening, then they tell you that your eye pressure is okay or a bit high. This is difficult. This is not the or this is not the way to diagnose glaucoma. Okay, because glaucoma, if you want to diagnose glaucoma, you have to have the several tools or investigation to confirm glaucoma. Because once we start patient on the glaucoma eye drop, normally it's a lifelong glaucoma treatment. So that's very important to have a complete eye examination before diagnosis of the glaucoma. How do we diagnose glaucoma? Right. So several tools. The first one is very important one will be tonometer. This tonometer is used to measure the eye pressure. The normal eye pressure is between 10 to 21 or 22 millimeter mercury. So that's the normal range. Yeah. Most of the time, if you have eye pressure more than that, so we have to investigate further. Right? This is another glaucoma measuring eye pressure. Yeah, the eye pressure instrument to measure glaucoma other than the tonometer just now. So how do we know that you fall into open angle, close angle glaucoma? So there is an instrument called gonioscopy. So it's like a mirror we put on the eye, anesthetic. We already put the anesthetic drop into the eye, so you won't feel anything. So this basically, it's a mirror to look at the angle. This is the angle structure, you see. So from the gonioscopy examination, we know that you fall into open angle or close angle, or sometimes in between, narrow angle. Okay, because sometimes the management or the treatment will be a bit different, right? This is the normal looking optic disc when we look through our slit lamp examination. Okay, the center here, you see here the white spot at the white rounding at the center here is about the ratio. Normally we measure the ratio. This cup to the disc area ratio, normally in normal people is between 0.2 to 0.4. Okay, it's a small cup at the center. Okay, you can see here. Okay, this is cup, very big, maybe 0.8. So this is suspicious optic disc. Not to say this is confirmed glaucoma. This is suspicious optic disc. So we have to do some further investigation to confirm the diagnosis of the glaucoma. What are the tools normally we proceed after we suspect the patient has glaucoma? Visual field examination, which is very important. Like I said, the glaucoma always disturb the peripheral vision first. Yeah. Okay. So this visual field to see whether the visual field defect or the problem in your visual field is because of the glaucoma or any other optic nerve problem, such as compression from the brain tumor, or optic nerve or eye stroke, yeah, which can cause some problem with the visual field as well. But the glaucoma will be a bit different pattern. Okay. This is another tools or instrument. We call that optical coherent tomography, or OCT. It's a scan basically to scan your retinal nerve fiber to see whether any thinning or any problem following the increased eye pressure in the glaucoma. So this is the normal one. You see all this green color scanning, okay, shows that this is normal thickness of the retinal nerve fiber. Compared to my right side here, there is some area of red color or yellow color here, means there is some retinal nerve fiber problem following the compression from the intraocular pressure. So there is some problem here from the scan. Okay. Who are at risk to get glaucoma? So first one will be age. Yeah, most of the time is 60 and above, right? So positive family history, very important. So please make sure you know about your family, right? Immediate family, I mean, not like, you know, distance relative, things like that. This is immediate family, your parents, maybe your auntie, uncles, and your siblings especially, because if you have family history glaucoma, the study they said if you have family history of glaucoma, you have at risk to develop glaucoma 4 to 9 times higher than the normal population. Okay. Another risk factor will be the race. Yeah, the ethnic group. African American will be higher risk to develop glaucoma. They said about 15 times, you know, higher than the normal population. Of course, the high eye pressure is one of the risk factor, but the normal eye pressure as well can get have some optic nerve damage from the glaucoma. Okay, if you have a very high power from short-sightedness or long-sightedness, power terlalu tinggi, rabun jauh atau rabun dekat, also you ada risk to develop glaucoma. Of course, like I said just now, you have history of eye injury before, pernah kena kemalangan, kadang-kadang bila tanya tak ingat. Rupanya, oh masa kecil dulu ada pernah kena bola dekat mata. So ini adalah salah satu risiko untuk develop glaucoma later. Of course, steroid long-term, ya, long-term steroid medications. Okay, steroid medication ni sometimes if you ask sometimes they will say, I never use any medication, but I'm taking herbal medication. Tak kira lah Chinese herbs ke, Malay herbs ke, jamu ke, sometimes it contains steroids. Yeah? Then they will always use this for long term. So the purpose is for, you know, health purpose. So this kind of medication is you have to be careful because it can induce cataract and glaucoma as well. So some patient with the disease, contohnya sakit sendi, rheumatoid arthritis, or SLE, you know, the doctor or the specialist, the physician put them on steroid to control their disease or inflammation. Yeah? So this group of people will have to go to the eye doctor regularly, yeah, to check for further complications of the steroid. Okay, apart from the high eye pressure as a risk factor for glaucoma, poor blood circulation to the optic nerve head, especially for the vessels surrounding the optic nerve also, is a risk factor to develop glaucoma. So that's why people with diabetes, migraines, and then darah tinggi, high blood pressure will have higher risk to develop glaucoma. Then they said if you have diabetes, you have twice or 2 kali lebih risiko untuk dapat glaukoma. Okay, so we move to the treatment. What are the treatment options? So bila doktor dah cakap you dah confirm glaucoma from the serial test, from the scan, from the visual field, so you confirm ada glaucoma. So it depends whether it's an early stage, moderate stage, or end stage. So most of the time, we try medication first. We try 1 or 2 medications, depends on the baseline eye pressure. Masa mula-mula diagnose, berapa pressure mata dia, ya. Kalau kata pressure mata mula-mula kita diagnose dalam 28 ataupun kurang daripada 30, mungkin kita akan cuba 1 medication ataupun 2 medication dulu, ya, eye drop. Kalau terus tiba-tiba, terus 50 ke 40, 50 very high, then you might try straight ataupun start with the 2 or 3 medication eye drops, ya. Eye drops for glaucoma, there are so many of them, yeah, but each one ada function dan got side effects. So that's why for the glaucoma treatment, for the beginning, is not everybody will say happy with the treatment. Some patient try 1 eye drop and then they say my eye develop severe allergy, redness, discomfort. Then they stop themselves and they will come back to see eye doctor. This is very sad because if you don't come back and see us, you never know, your eye pressure will keep on increasing, and then the nerve, optic nerve will continuous have compression, so you will have irreversible vision loss. So please, if your doctor started you on the medication, you have problem with that, you have to tell the doctor and discuss. You may have to change to add another type of eye drops, or we do laser treatment or surgery. Okay. Right. So another type, if there is a beginning, you have okay with the medication, but later your visual field or your nerve function is going down in your vision become worse, even though with the maximal medical therapy eye drops. So the doctor might suggest you to have surgery. The surgery, this is we call that trabeculectomy. This is a conventional ataupun cara lama lah, ya, surgery. Dah lama dah surgery ni dibuat, lebih daripada 40 tahun sudah. Tapi sekarang pun kita masih buat dalam certain cases, terutamanya glaucoma end stage ataupun pressure yang terlalu tinggi, ya. Dan yang cara terbaru kita panggil minimally invasive glaucoma surgery. Saya akan ada short video about this trabeculectomy and MIGS surgery, ya, untuk bagi lebih picture ataupun pengetahuan tentang bagaimana surgery ini dibuat. Okay. Untuk mereka yang mempunyai keluarga, ibu bapa, parents with the glaucoma, ubat-ubatan ni mungkin familiar lah, ya. So there are so many from different company, different action. Ya, ada eye drops yang to reduce aqueous production ataupun fluid production. Ada yang untuk melancarkan the drainage system, increase outflow. Ya, so it depends. You have to see the patient himself or herself. Ya. Ini salah satu contoh laser treatment dalam pesakit glaucoma. So you can see here, yang laser ni nampak ada satu lubang dekat iris, is a hole in the iris. So this is again to increase the drainage system in the eye. Okay, semua treatment sama ada laser, eye drop ataupun pembedahan, tujuan dia sama, ya, untuk reduce the eye pressure. Okay, ini adalah salah satu short video berkenaan dengan trabeculectomy yang biasanya kita buat. Ini cara yang terdahululah, dah beberapa tahun, yang macam saya cakap tadi, dah 40 tahun kita buat benda ni, ya, untuk kurangkan tekanan mata. Alright.
Trabeculectomy, also called filtration surgery, is a surgical procedure performed for treatment of glaucoma. The treatment involves removing part of the trabecular meshwork and creating a new escape route for the aqueous humor. When successful, it allows the aqueous fluid to drain from the eye into an area underneath the conjunctiva, where it is subsequently absorbed by the body's circulatory system or filtered into tears. After surgery, aqueous humor drains into a filtering area called a bleb under the conjunctiva. Since the surgery is usually performed near the top of the eye, the bleb can easily be concealed behind the upper eyelid.
Okay, so basically pembedahan ni melibatkan doktor remove sedikit bahagian pada trabecular meshwork, pada angle tu, untuk kita tak nak lalu trabecular meshwork yang dah tersumbat tadi, so we create another like bypass this angle structure so that lebihan fluid from the eye go outside the eye through this yang kita create channel yang baru ni. Okay, itu adalah main idea untuk trabeculectomy.
Trabeculectomy.
Okay. So you nampak ya, selalunya kita akan buat di bahagian atas mata, di bawah kelopak. So bila dia tutup mata tak nampaklah tempat surgery ni ya. So ada kita panggil partial thickness bahagian mata putih ataupun sclera ni. Dan kita ambil sedikit bahagian ni, kita buang untuk membuat satu opening ataupun lubang ya. So that air daripada dalam mata akan keluar melalui saliran ni, dia macam drain ataupun longkang lah ya, untuk kita kumpulkan di bahagian atas mata dan diserap oleh body circulation. Okey, diserap di bahagian sini. Kita nampak ya, lain sikit kan bahagian ni. So ini area yang takungan air lah kita panggil ya, collection of fluid inside here. Okay. So ini melibatkan pembedahan. Boleh nampak kan? Pembedahan ada nanti kemudian kita akan jahit ya. Ini dah sembuh lah, so tak nampak jahitan semua. Biasanya ada jahitan kat sini. So ini melibatkan pembedahan. Okay. Cara kedua, kita memasukkan pembedahan juga, tapi kita guna alat ya, kita guna device, kita panggil implant, untuk mensalirkan air from anterior chamber here, same thing to the area untuk draining system ya, sama juga. So that to take out the fluid, excess fluid from inside the eye, go to this area. So the water collection over here untuk seimbangkan the eye pressure. Alright, this is a implant. We call that implant. Okay. So we have minimally invasive glaucoma surgery. Lately memang ramai yang lebih suggest kaedah ni lah. Sebab dia, of course, sebab dia tidak melibatkan pembedahan yang besar dan lebih dia punya complication kurang ya. Tengok alat ni kecil je kan. So lepas ni saya akan tunjukkan video. Bila dah terhasil pembedahan tu, kita akan nampak sangat kecil je alat ni. It's very tiny drainage system ya, drainage device over here ya. So same thing, the function is to create a passage ataupun drainage system from anterior chamber into the collection area over the below the conjunctiva. Okay. So kita tengok sikit short video berkenaan dengan stent.
The Zengel stent is 6 millimeters in length, and when hydrated, it becomes very soft, compressible, and tissue conforming. The gel stent is preloaded in a disposable injector with a 27-gauge needle. The Zengel stent creates a patent channel through the sclera, allowing aqueous humor to flow from the anterior chamber into the subconjunctival space. A sub 2 millimeter clear cornea main incision is recommended for the procedure. The injector enters the incision and travels across the eye to the superior nasal quadrant where the stent will be placed. Due to the ab interno approach, the gel stent is placed properly away from the iris and endothelium. The needle is inserted through the trabecular meshwork, creating a scleral tunnel to the subconjunctival space. Once the needle exits the sclera, the location is verified or adjusted as needed. The injector is further advanced until the full bevel of the needle is visible. The needle is then rotated towards 12 o'clock. This rotation helps avoid the soft stent from curling. The gel stent is delivered by actuating the slider on the one-handed injector, while the other hand maintains gentle fixation on the eye. The sleeve provides longitudinal placement control during the deployment. The gel stent is delivered into the non-dissected tenon space, creating a connection from the anterior chamber to the subconjunctival space. Its lumen is designed to regulate the outflow and avoid hypotony. The aqueous humor will begin to flow immediately, creating an ab-internal bleb, which over time becomes a low-lying drainage area.
I know it may look a bit scary when you see the needle, but believe me, the patient memang tak rasa dan tak sakit because the eye is already anesthetized. Okay, then this is quite a short procedure as well. Okay. Another device, alat, ya, kita panggil eye stand, ya. So ini adalah sejenis implant ataupun alat yang memang sangat kecil, is very small device. Yang ini adalah antara teknik terbaru lah untuk mengurangkan tekanan mata. Dia semacam implant juga, ya. So I will show you the video of this.
The eye stent inject system does this by creating tiny channels to allow fluid to drain from the eye. The device may also reduce your need for additional surgery or glaucoma medications. The eye stent inject is made of titanium. It is about 1/3 of a millimeter in length and 1/3 of a millimeter in diameter. It is one of the smallest medical devices in the world to be implanted in humans and is approximately 25,000 times smaller than the most common surgical devices used to lower pressure in the eye. The eye stent inject procedure is performed within a surgery center or hospital environment. A topical anesthetic drop is used on top of your eye, and a small opening is made to access the front part of your eye. Next, a gel is injected into your eye. A medication may also be added to make your pupil smaller. The eye stent inject system is then inserted to access the angle of your eye. A special lens is placed on top of your eye so your doctor can see inside. A protective covering on the handpiece is retracted, and the first eye stent inject is placed into the meshwork of your eye, creating a tiny channel to allow fluid to drain from your eye. The handpiece is then rotated, and the second eye stent inject is placed, creating an additional pathway for fluid to drain. The handpiece is then withdrawn from your eye. The goal of this procedure is to restore the natural outflow of fluid from your eye.
So, sama juga ya, semua untuk tujuan dia to reduce the eye pressure. Apa-apa cara pembedahan sekalipun, it has to be, you have to discuss. The eye doctor normally will discuss with the patient and then the relative, the benefit and the risk of each surgery, which is more suitable for each for patient. And that it depends also on the stage of the glaucoma as well, right? Okay. Can we prevent glaucoma? So we can prevent, especially at the early stages. The prevention is mainly to avoid the vision loss, right? Okay, you have to get regular eye examination. Okay, the earlier you come, and then if you detect early, then the better the prognosis. Okay, know your family eye health history. If you're diagnosed already to have glaucoma, please take the eye drops regularly. Okay, you don't simply because you don't like the eye drops, you just stop the eye drop and then come back to eye doctor after 3 years. So it's quite sad because like I said just now, whatever vision or optic nerve function loss, you cannot get back. Yeah. Okay, if you like to play the high-speed racket sports, please wear the protective eye protection goggles. especially when you're using power tools, because serious eye injuries can lead to glaucoma. Of course, healthy healthy lifestyles as well. Like I said just now, one of the factors to develop glaucoma is the poor blood circulation. So regular exercise and then taking healthy diets also can, you know, improve all this blood circulation and reduce the risk of the glaucoma. Okay, what kind of exercise? Right, any exercise, moderate exercise. But one type of exercise which is not advisable in glaucoma patient, especially in advanced stage, is when you have the position, what you call that, headstand. Headstand means head down, leg up, you know, that position. Normally they said they do this in yoga, you know, so this is not advisable, because when you do that position, it increases your eye pressure 2 to 3 times normal than normal eye pressure, which is, you know, not good for the especially glaucoma patient and advanced stage glaucoma. Okay, that's about exercise. What about diet? Okay, diet contain vitamin A, B, C, and antioxidant is good. Everything has to be balanced. Leafy or green veggie, colorful veggie, and, you know, the fruits also good, yeah, because it contains all the antioxidants. Okay, what about they asked me about coffee. Okay, what about coffee? Caffeine is well known to increase the eye pressure. Not 1 or 2 cups per day, but maybe people who taking caffeine coffee more than 3 to 5 cups per day, because caffeine, after you take coffee, they measure the eye pressure. The eye pressure will be higher, you know, constantly higher for the next 1 or 2 hours. So of course, if you have glaucoma, if you already diagnosed glaucoma, or you have end-stage glaucoma, this is not good, because it can further cause compression to your optic nerve. All right. So with that, thank you for joining me tonight. So if any problem, don't hesitate to ask any question. All right. Thank you very much.
Thank you, Dr. Umi. Very informative. Okay, so for all the attendees in our Zoom session, our Zoom live session, if you would like to ask any question, either you can unmute yourself or you can type it into the chat box. Dr. Umi, you can unshare your screen. Yeah. So any questions from the Zoom attendees? If no, actually I have one at the moment. While I'll let you all have some time to think of your questions, yeah, before to ask Dr. Umi. I have one question from our Facebook Live, which is from Jean Lee. She's asking if my mother-in-law has glaucoma due to thyroid, does her son, which do not have thyroid, has this risk of glaucoma as well?
Okay, so in this case, this is what we call that secondary glaucoma. Glaucoma because of the thyroid. Yeah, this is not primary, I guess. So the risk is not the same like if you have primary glaucoma. So the risk will be less. But anyway, thyroid itself, you know, the thyroid problem also sometimes can be hereditary as well. So the main thing, the person asking Jane just now has to, have to check for her thyroid hormone level. Okay, because that one also will contribute to what we call that secondary glaucoma. This is glaucoma because of the thyroid. Yeah.
So since regarding to Jane's question, Dr. Umi, would this glaucoma disease would pass from generation to generation? Because I believe she's concerned whether, you know, it will pass on to her son. But let's say if it's not her son, I mean, would it pass on to the grandchildren as well? Is there any of this kind of possibility?
Okay. Because you said the mother-in-law has thyroid eye disease. Okay, so this is secondary glaucoma. But in case, the mother-in-law has a pre-existing glaucoma. We don't know whether this is contribute to the thyroid or primary open-angle glaucoma. So yes, there is possibility that the grandson will have glaucoma, but maybe not at the younger age, maybe later. So maybe we will advise that patient with a like positive family history. In the Western, they advise to go to eye checkup as early as like mid-30s. Yeah. Okay.
Okay. Anyone from the Zoom attendees have any question? If you have, you can unmute yourself. Don't be shy. You can ask any question, not necessary just about glaucoma. You can ask any question. Now it's like an open clinic for you, free consultation.
If I cannot answer, Dato can answer also.
Yeah. I have a few doctors here. Yeah,
exactly.
Okay, Dr. Umi, there's another question from our Facebook Live. Okay, from Zalina Yusuf. Okay, she said, Assalamualaikum Dr. Umi.
Waalaikumsalam.
Bolehkah pengidap glaukoma sembuh sepenuhnya? Adakah ubat titis mata steroid masih perlu digunakan sekira pembedahan dilakukan?
Okey, bagus soalan tu. Saya nak bagi tahu tadi, mungkin saya tak sebut tadi masa dalam slide saya. Okey. Glaukoma macam Zalina macam sakit kencing manis. Dia boleh dikawal tetapi tidak boleh sembuh sepenuhnya. Itu satu ya. Dia kalau ingat glaukoma, ingat macam sakit kencing manis. Memang tak boleh sembuh, cuma boleh dirawat dan dikawal untuk mengelakkan daripada kehilangan penglihatan ataupun fungsi saraf mata bertambah teruk. Okey, itu satu. Okey, dia tanya tadi berkenaan dengan boleh tak rawatan steroid selepas pembedahan ya. Okey. Sebenarnya lepas pembedahan memang terutamanya saya guess cataract lah ya, apa-apa pembedahan, kita akan bagi steroid sebab lepas pembedahan biasanya akan ada radang mata untuk sementara waktu ataupun inflammation ya. So steroid yang kita gunakan adalah sedikit berbeza. Kita panggil IOP sparing lah, macam steroid yang tidak menyebabkan tekanan mata meningkat ya. So kita ada beberapa jenis steroid. So steroid ni akan ada risiko yang lebih rendah untuk meningkatkan tekanan mata. Dan steroid yang digunakan kita akan pastikan tidak digunakan dalam tempoh masa yang panjang, cuma short period of time sahaja. Okay.
Okay, thank you, Dr. Umi. We have one question from our Zoom attendees, Muthu Krishnan.
Yeah.
Just now he saw the few types of implants to release or reduce the eye pressure. Surgical procedure. Usually above what eye pressure is implant recommended?
Okay. This implant compare dengan conventional trabeculectomy, biasa most of the time dia akan like I said lah, dia akan guna untuk mild to moderate glaucoma only. Okay. So if you using now 1 or 2, 3 glaucoma eye drops, then you may benefit from this implant. Okay, mild to moderate. If you have end stage of glaucoma, you have 4 anti-glaucoma eye drops, then you may not be suitable for this implant. All right. Okay, because the eye pressure normally, IOP or eye pressure reduction by this implant is not as good as the conventional method, right?
Okay. We have another question from Liao and Louis from our Zoom attendees. What about cataract problem? Need more information.
Okay, cataract problem. Okay, so if you have, like I said just now, the photo I showed you, the mature cataract, which can cause inflammation because of the leaking proteins and then cause the glaucoma, acute glaucoma. We call that suddenly increase in eye pressure. So that one need eye pressure reduction by the eye drops, maybe oral medication to reduce the eye pressure, as well as anti-inflammation like steroids, yeah, to reduce the inflammation during that time. then finally or eventually need cataract surgery, of course, because cataract is the main cause of the glaucoma in this case. Okay, another type of the cataract, right? So some patient with the smaller eye, we call that narrow angle or close angle, going to close angle, they are quite sensitive to even mild cataract. Okay, let's say they have mild cataract. In normal people, they don't have problem with the outflow of the fluid. But in this narrow angle, already narrow angle, small eye, little bit of cataract, the cataract getting thicker a bit, so they will totally block the outflow of this fluid, so they can develop glaucoma suddenly. All right, this kind of patient, we don't wait until the cataract getting thicker and thicker. We will advise you have to do the cataract surgery early, even though you still can see, but your cataract already blocking the drainage system. So this kind of problem can happen with the cataract. Yeah. Okay.
Okay. If there's any more question from the Facebook Live participants, please do type it into the chat so I can actually read it out to Dr. Umi. Now, Dr. Umi, I'm just curious, when we talk about the type of procedure or treatment for the glaucoma diseases, some, I think they may confuse, like they will ask like a general term, can a glaucoma be cured by a laser procedure or laser technique?
Okay. So the laser treatment, like I said just now, I showed you the hole in the iris, right? That normally in narrow angle or close angle glaucoma. Okay. So if there is acute rise during that time, there is pressure increase, then cause pain and symptomatic. So we normally give eye drop, of course, and then we try to do the laser to reduce the eye pressure at that moment. Okay. Not to say you can cure, but sometimes some patients, after we do this laser, the eye pressure may be normalized after that. So we just monitor. Okay. They maybe only need one eye drop, or later we may off the eye drop. Yeah. But they need very closely follow up to monitor the eye pressure. Not to say cure, but we will monitor closely, because sometimes in narrow angle glaucoma, especially, even though we do laser, if they still have cataract, then this cataract itself can cause something which can block the angle later, right?
Any questions from the Zoom attendees? All very shy. Only me asking question only. Okay, so Dr. Mi, since just now you're talking about the laser, which you do you sort of like a puncture hole on your iris to reduce eye pressure. So what would be considered the normal eye pressure range?
Okay, just now I mentioned the normal eye pressure range is between 10 to 20 or 21. Okay, this is the normal, right? More than that, we have to investigate further whether this patient has glaucoma or not. Depends on the cup-disc ratio, visual field, and maybe the scan OCT. All right. Okay. If you have what the question just now, Anna? The normal eye pressure, right? You asking?
Consider the normal range.
Yeah. The 10 to 21.
10 to 21.
Yeah, because some patient, we have a group of people or patient fall under normal tension glaucoma. Means the eye pressure may be just 15, 16, but they develop glaucoma, they develop optic nerve, optic disc change, and visual field loss, So this group of people, we still treat, and then the aim or the target eye pressure will be lower than the normal population. Normally we target maybe less than 15. That this kind of group of people with a normal eye tension normal tension glaucoma will need lower eye pressure to prevent the further damage of the optic nerve. Okay.
So doesn't mean that you're within the normal range, you are safe lah.
Yeah, exactly. That's normal tension glaucoma.
Okay. We have one question from the Zoom attendees. It's from Lisa. If the glaucoma is caused by cataract or trauma, will there be a glaucoma problem after the cataract removal? or after the trauma problem is resolved?
Yes, definitely. If you have trauma, which cause, we call that cataract, trauma, then cause cataract, at the same time cause glaucoma. If you remove the cataract, sadly, the glaucoma will still be there because the trauma itself can damage the angle permanently. All right. So this kind of patient will be difficult to, depends on the extent of the damage or the angle damage. Maybe 180, we call that 180, or the whole 360, the whole angle damage, and then this patient might need surgery. Yeah, the surgery will be the solution.
Okay, next question from White Teng. One White Teng, Dr. Umi, ada kebarangkalian tekanan kerja, that means stress, due to stress, would cause glaucoma. Sorry, my bahasa is like.
Okay, so good question. Okay, stress. When you stress, the body release certain hormone, like cortisol. These hormones will have some problem with the blood circulation. Disturb with the blood circulation. So like I said just now, when you have problem with the blood circulation, aliran darah ke optic nerve is disturbed. So slowly you will have glaucoma as well. So if you ask me whether the stress can induce, not immediately, but slowly, it will, there will be higher risk to have glaucoma, all right? Because of the hormonal changes and the blood circulation, all right?
Yeah, I think it's a very good question because nowadays a lot of people are working from home.
Yeah.
I think the stress is actually more, right?
Exactly.
Okay, since White Teng asked about that question about stress, I'm just wondering if, let's say, somebody with hypertension, all right, is a high blood pressure, so would they actually have also higher risk of getting this glaucoma as well?
Yes, hypertension, if you see, if you have long-standing hypertension, especially together with the cholesterol problem, things like that, you will have your blood vessels, especially the small one, will have like atherosclerotic changes, narrowing, or some changes in the blood vessels itself. This one will contribute to, like I said just now, blood circulation. So yes, hypertension also will have higher risk to develop glaucoma. Okay.
Okay. I think I got a lot of questions to ask Dr. Umi. Okay, if let's say the patient has glaucoma and required a surgical procedure, but she's pregnant, would it be suitable to go for the procedure?
Okay, so this is, we have to discuss with patient and then see the patient as a whole, which stage of the pregnancy, whether this glaucoma surgery is really necessary, whether it's not, whether the medication alone can help to reduce the eye pressure. If possible, we try to avoid, because once we do the surgery, we have to put a lot of eye drops, a lot of stress to patients, and then frequent follow-up if possible. But if we have to discuss with the gynae or the ONG doctor, who take care of the patient, to discuss which is the best option for the patient. Okay. But in pregnancy, reported cases or the studies done, the patient with glaucoma and have pregnant, they will have, because of the hormonal changes, they will have a higher risk to develop worsening of the visual field loss in pregnancy. Okay, so just have to beware of this.
Okay. Dr. Umi, what would be an average age group, assuming they do not have family history that actually have glaucoma? What would be an average age group people have higher risk of getting glaucoma?
Okay, most of the time, more than 60 years old. More than 60, okay? But normally, like I said just now, if you have risk factor, especially positive family history, and you have multiple medical problem, blood flow problem, you have to come early for the eye checkup. Yeah, some studies said mid-30s, and then some studies said start 40 years old. Okay.
I suddenly thought of another question, because regarding, like just now you mentioned about the normal range of eye pressure.
Yeah.
Now, if the pressure is very high, would the patient experience any sign of symptoms of pain or vision affected? You know, would they have any symptoms or not?
Okay. It depends on the what type of glaucoma. Okay. Patient, the first group of patient, the open angle glaucoma, like I say, because it's only partial block, it's partial, so the eye pressure will build up very slowly. When the eye pressure builds up very slowly, normally they will have no symptom. Yeah, because very slowly, you don't realize. Yeah, suddenly the pressure going up. So even though sometimes this group of patients will present to us with the eye pressure 40, 50, but they don't have any pain. You know, the normally the symptom when they present to us is some blurring of vision because of the visual field loss.
Okay. All right. So, is there any more questions from the floor? Any more questions? If you have, you can actually unmute yourself and ask the question. And as well as for our Facebook attendees, if you have any question, you can post your question in the chat. Now, if you all notice, we have actually sent the free eye, because I promised you for the free comprehensive eye examination for all our attendees. Okay, so we actually post the link for you, and you can actually do this later. Okay, the link will be open until tomorrow by 5 p.m. You can register for the free eye screening. It's a comprehensive eye examination, which one of it we will also check either you have any sign or symptoms of glaucoma. Also check if you have cataract, the health of your retina, your optic nerves, right, Dr. Umi?
Yeah.
What else we check? Macular, your vision. Okay, so it's actually pretty comprehensive. You can click on the link and you can do it later. All right, you can do it later after this session. Dr. Umi, just now you share about the procedure of the eye stand and the implants.
Yeah.
It's one of the latest technique, right?
Yes, that's the latest technique. The purpose of them to develop or create all this technique because they try to reduce the complication, especially the blood-related problems such as infection, and then the too low eye pressure after the conventional surgery. Okay.
So we also you also perform this procedure?
Yes.
Okay, so if there's no more questions, I think it's also pretty late. So if there's no more questions, Dato, you have anything you want to top up?
Please, Dato.
We have a very senior surgeon in the house today, actually. So if
very nicely done. Very nicely done. I think what Dr. Umi mentioned about all those implants are what you call micro mix. Micro is
minimally invasive
mix. So it's minimally invasive glaucoma surgery. As compared with a standard trabeculectomy, this has less complications, like what Dr. Umi said. It's quite easy to perform, actually. I think it's easier than a standard lab surgery. Yeah, I'm glad you all are doing it. It's very nice.
Yeah.
Good lecture. Thank you very much.
Yeah.
Thank you, Dr. Umi. Actually, it's very informative. I hope all the attendees benefit and actually create more awareness on this silent blinding disease. So for the information, our next webinar will be on the 17th of December, which is also a Thursday, at 8:30 by Dr. Lim Meng Hock. All right, he will be talking about the red eye. So I think this is actually pretty common, but you would want to find out what other causes of the red eye, what are the complications will affect, you know. So it's not as simple as that. If it's not treated in an early stage, what would be the damages or the risk factor? So Dr. Lim will share more in depth about the red eye in our next webinar. So if you are interested, then we will post in our Facebook. Remember to like our Facebook page, and then we will actually send you the registration link again. Okay. So thank you, Dr. Umi. Thank you, Doctor. Thank you all the attendees for joining us today.
Yeah, thank you, everyone.
Yeah.
Good night. Thank you,
Good night.
Dr. Umi. Thank
Good
you.
night. Thank you very much.